So should
Oh, okay. Someone has started recording.
yeah, I
Okay.
started it on my computer. You can record as well on your computer. So just press the record button, take permission. If there's space, it will record. Otherwise, it will stop on its own. Don't worry about that.
Uh, okay.
Has Bharti ma'am joined? She had messaged that she's not able to.
Got 17 people already
No,
in.
Bharti ma'am is not there. Not yet.
I don't know. Somehow I'm not able to see the participant list.
Oh,
There are
you are the
17.
host.
Yeah, there are
There are
17.
17.
Yeah.
And sometimes it gets locked. You can't open
Yeah.
it.
Now I can see. Actually, I had switched on the link.
Since we have just opened this late, can we give 5 minutes for people to join? Whoever is.
Sure. So we'll make it 4:15.
Yeah. So then we'll start at
Yes.
4:15.
Yeah.
You can probably stop recording now and start recording when we are going to actually start the.
Greetings, I am Professor Shilpa Sharma. I am a professor in the Department of Pediatric Surgery at the All India Institute of Medical Sciences, New Delhi. Today, I'll be talking about flexible training options that are available in the specialty of pediatric surgery both in India and abroad. Let me share my screen. So the most important thing when one wants to adapt to foreign places to learn is the attitude to adapt and explore. So I'm really grateful to my parents that they had cultivated this attitude in me ever since childhood. During our stay in Nigeria, where I stayed for 8 years and my parents stayed for 10 years, so we came down 2 years earlier, we used to get 3 months of vacation, and during this 3 months of vacation, 2 months used to be spent in Europe and 1 month in India each year. And at school also in Nigeria, just like in Japan, they make the children learn the skills of life. In Nigeria too, we learned how to clean the classroom, the toilets, and even cut grass with grasshoppers, do gardening. We used to march to stadiums in the heat and with thirst. You can imagine the whole school marching down the lanes. We also had to participate in the cultural activities, in the television shows. So I used to teach all my Nigerian friends Indian dances and songs, and even taught them how to wear saris. So it was a cross-culture adaptation, and I learned their language. I had to learn it, and because otherwise I would lose marks in school, and I learned it so well that I used to top the school despite being a foreigner with high marks in their language as well. So the objectives of my talk would be to take you what constitutes surgical training, why, when, how, share some personal experiences, only a little bit because I can't do all of that in half an hour, and some information on the training opportunities to explore. Coming to surgical training. What is surgical training? It's not just the surgical aspect. There is so much more before it and after it. So the patient selection, the pre-operative preparation, which in India, many people do it for us, but here when you go abroad you have to learn to do each and everything by scratch yourself, the surgical part, and then the post-operative care, as well as the need for effective communication and problem solving when it arises. So the constitutes of surgical training are the knowledge, skill and techniques, the ability to handle complications, the ability to know these complications, the technical proficiency, decision making skills and patient safety. The ethical considerations should be there. It should be a continuous learning process, and simulation based training is the way to go because it allows you to practice and think. The mindset develops to think in that manner before you go on to the real patient. So the soft surgical skills, these were not taught to us during MBBS or MS. We have to learn these. Some of these we learn ourselves with our behavior, but when you have a system that teaches you how to do it in reality without pressure and know the importance of it, like when you're saying anything to some colleague, each and every sentence you speak, your eye gesture, your hand gesture, everything matters. So leadership, problem solving, communication, collaboration, emotional intelligence, these are very important to build relationships, lead teams, make decisions, adapt to the change, solve problems together, and manage your time as well. Patient care skills include a teamwork, honesty, sincerity, handing over to the next team in time with patience. Give time for that. Do not do it hurriedly. With a positive attitude, active listening. Listen to each and every sentence that your colleague is telling you. Compassion for the patients and for the colleagues, and responding to complaints. Do not get offended when if somebody complains about anything. You have to talk properly and communicate your way of thinking. Why go abroad? Why not do everything in India? You know, when I went to the UK in 2016, the neonatal care there was just too good. We were 20 years behind. We still are 20 years behind no matter what we do, because they think ahead of us. So when you go abroad, it increases your horizon. You realize the gaps in the existing system. Otherwise, you would not know. If you have not seen that better place things are in place, you will think you are the best. I'm at AIMS, New Delhi, so it's the best institution. What more do I need to learn? But your curiosities will be answered. Your vision will be widened. You'll understand intercultural variability. For example, there was a child with many syndromes. I never thought that child would ever make it, but with patience, that child survived during my full tenure there, you know, on ventilator, but the child was alive, active, and growing well. So, hoping for a cure. So, these things you have to learn when you are going to go to such scenarios. Adopting what is best in your setting, and then, of course, you get to make international mentors, and in future, you are able to mentor some of your mentees. When to do that? Before training, during training, depends on your institution, but hardly any institution in India will allow you to go for a period within your MCH 3-year training program. Soon after training is the best time, but one should go after one has acquired all the skills. Otherwise, one will get frustrated. So whatever you've learned in your MS, in your MCH, go on for a hands-on thing for 1 or 2 years and know where you are, know where you stand, understand the things before you go into a different world and you try to communicate and learn from there. Passion never dies, so there is no age limit. You can go anytime you want, after all, of course, fulfilling your family responsibilities whenever you get a gap. So as for myself, I did PhD quite late after my MCH for 6 years, and then I'm still learning liver and kidney transplant and pursuing an MBA degree as well. How to get the information, know what to do. So attend conferences, listen, meet people, ask questions. When you go out for conferences, do not spend your time in tourism. If you want to do any tourism, do it one day before or one day after the conference. But when you're in the conference, apart from your paper, you've gone there to listen to what others have to say. Only then will you be able to realize the gaps in the treatment and what's happening, and then try and ask questions whatever you don't understand. There is very less time for discussion during the conference, then you can meet during the tea time, lunch time, and then ask whatever is left in your mind. Make notes. These are very important. When you come back from the conference, you again read your notes. So there are WOFEB's international fellowship programs, mentor-mentee program, ICMR training fellowships, Indo-US fellowships, and one should always learn to save and spend for training. It is not a lavish expenditure. It is for yourself. You're earning because you want to serve the humanity. So if you are spending on yourself, in future it's going to help your patients. It's not yourself, it's your training. So there's no harm in spending or going out for training. Knowledge gained is quite precious. Patience is the key. So I had got an offer from Slal's Transplantation Institute way back in 2010, but I could not go because my institute didn't allow me. Then at King's College London also I went, but just for a visit. I could not stay there longer to learn the liver transplant in 2014. Japan, now I'll talk about some experiences of mine which I've got over the years. So Japan is a very nice country. I've been there 8 times. What do I learn from there? Humanity, expertise. They perfect each and every step before they move to the next. Operation theatre is like a modular theatre with buttons all over. Good planning. The little steps are appreciated. They respect the seniors. There is very good hierarchy system. So the NICU there was in such a manner. They also had less nurses, but they made use of the parents. So they trained the parents. The parents were taking care. One mother was taking care of her child, and there was a glass around the circular NICU. So around 100 babies in the NICU. All of them have a glass facing outwards. So the father can come from outside the glass, see the baby and go away. So such a nice communication system was there. I had gone to Scotland as well, where I met Robert Karaki. Their ICU was fully equipped. Many babies were on ECMO, a thing which we had not seen in India way back in 2007. I also visited Cincinnati Children's Hospital, and there they had 17 theatres all in line. So apart from pediatric surgical theatre or the colorectal theatre where Pena was working, you could go into the other theatres with permission, of course, and look at the airway surgery. I saw pectus surgery, quite a lot of pectus nurse procedure which I had never seen in India, fetal surgery. So it was quite wonderful to see it during that time. It was quite astonishing. It was all in the dark. They were doing laser therapy of the trachea. So they had put a bronchoscope inside antenatal into the fetus and taken care of the laryngeal atresia, and then twin transfusion syndrome. These two patients which I had seen. And then I also saw liver transplant. That was my first exposure to liver transplant. Everybody inside working together. Then hemangioma excisions. I used to wonder how they excise these, but I learned that it has to be done in a stepwise manner. I saw a bit of cardiac surgery as well. Pediatric urology, Dr. Pramod Reddy. I attended his antenatal clinics, and even before the child is born, they would, before the patient comes to the outpatient, as soon as the report comes, they will discuss the report early morning, 6:30, 7 o'clock. Medical legal case discussions. First time in my life I realized that these can be such a big problem. Simple thing like undescended testes. There were questions on how was the vas tackled during the surgery of this adult who was a child at that time, 10 years ago. He was having infertility, so they wanted to have all the records and planned to sue the surgeon. So the importance of these things I learned. So I had mentors in Alberto Pena, Mark Levitt, Pramod Reddy, Richard Aziz Khan, and Cromwell Home, a renowned fetal surgery surgeon. In this photograph you can see Dr. Subhashish Saha. He was already there before I had come, and we had a room, they had a guest house kind of an accommodation for all the people who were visiting Cincinnati. So you can see people from different countries staying there. This was the first time I saw that star loan retractor. Dr. Pena had done this surgery. Hirschsprung disease, such a long length of bowel he had removed in the prone position, and when I came back I did it in my patients. At Austria, Graz, I saw Michael Holberth and Amulya Saxena. They had a wonderful hospital. The children's hospital was really nice. First time I saw helicopter transfer of patient. So the helicopter is right within the building, just outside the building, and then they get the patient right inside, and then everybody is working on that patient. They do quite a lot of ortho surgery as well. So in Graz, the pediatric surgeons were doing the pediatric orthopedic surgery. It was quite a wonderful hospital. Great Ormond Street Children's Hospital. Everybody dreams of going to this hospital. So I went there in 2014 for 2 months. The first thing I learned there was fire safety. During the induction process only they tell you about fire safety, and astonishingly the next day, the day I joined, I had gone to the library in the evening and suddenly the alarm was ringing. Thank God I had done the induction course properly, so I knew that we just have to follow where everybody is going, and they have a hidden pathway, so I could see all the hidden pathways of the Kosh, which was built way back more than a century ago, in the 1850s I think it was built. And we had to, and within 5 minutes the whole building was evacuated and we were all outside, and it was a alarm just to check that everybody knows what to do when a real fire really happens. So I had a mentor in pyelodicopy. He was learning how to do thoracoscopic TF first time. This is when I first saw it. Pediatric oncosurgery, senior person like Edward Kiley, he would tell us stories on every Thursday. That was the academic day, and he would describe everything that came to his mind right from when the patient entered his outpatient room. He would say the patient came with an arm on the stomach. I thought this, I advised this. And even during surgery, if he made a little change, like a 1 centimeter increase in incision, he will describe it very nicely and share all his experience with the whole team. So that is how they have a collective experience when everybody is talking about what they are feeling, how they are learning, and going about cases. And we also did few surgeries in the ICU with the ventilator brought to the ICU, especially the gastroschisis patients. There was a good demarcation from pediatric urology, which I saw for the first time. Louis Spitz's lectures were there, where everybody from London came to attend. So I happened to go to Norwich for 6 months in 2016 with the ISTP fellowship. It was a very nice hospital with dedicated laparoscopic skill lab. So Dr. Sang was there in the lab, and he would make us do each and every procedure in the lab first before we got a hands-on on it. So the next day the patient is posted, but he would make sure that I tie my sutures properly in the lab. He has seen how I'm doing, and then only he will hand over his patient to me. There was a helicopter there as well. So in the middle of the night, the helicopter will come to the emergency. We will rush, and patients like IHPS completely in shock. And it was really heartening to revive them and take care of them and call the whole team together. Of course, an excellent team of pediatricians, pediatric nurses, and they would value even the opinion of a guest like me who had been there for the first time during any radio conference or pathological conference. With the skill lab, it got so ingrained in me that I developed my own model of TF and abdominal repair, and next year the pyeloplasty model will be ready. So this is the team at Norwich whom I met recently at the PESICON. So you can see Sandeep Kushku, he had gone after me to Norwich, and you have Dr. Shalini, Dr. Ravi Ramadwar had been there in the 80s, and Dr. Ashish Minocha. I've been to Romania twice. So here I saw the use of the vacuum suction bells for the pectus excavator, and I met Mr. Haller, and he was very nice. He took a workshop and he taught us how the instruments are made. So I visited 2 hospitals there, including the Curie Hospital. So they have very good orthopedic, pediatric orthopedicians in Romania, and they have a very good system. They are innovators, so they make many things, many innovative instruments for the use in children. Sidra Children's Hospital, Qatar, I visited during the WOFAPS 2019. Whoever went to the WOFAPS was given a hospital visit there. It's the best hospital that I've ever seen in my life. Their workshop was held there. It has a dedicated ECMO training room, so the nurses are trained to handle ECMO even before the patient comes, how the patient is going to come, how the ECMO is going to come, where each and every line is to be connected, and after the patient is received, left, right, every line is marked with a marker and how they are connected. Within minutes they will do it even if the patient is not there. So just as a practice. The Red Cross Children Hospital in South Africa, I just visited recently, attended their workshops there. I was a guest faculty there. So in their wards they have many patients with gunshot wounds, and their skill lab was fully equipped with so many camera towers. So they had a full running center which was used by gynecologists and also by general surgeons. So that is where I learned that when you have a team together with multiple specialities, you can develop a good skills lab. You don't with pediatric surgery alone it will not thrive perhaps. So coming to the training opportunities, when you try and training opportunities in India, the first thing that comes is Med Training India. But I have written an email to them to prepare for this talk, and the reply I got was that this is only for non-Indian students. So anybody from abroad can apply to them, and they will tie up them with centers in India. There is a good center in Singapore, KKH. Dr. Tichin had gone there for training. And Cincinnati Children's Hospital, I've already told you. Then in the UAE, there is the MBRU Hospital, where they can look for a clinical attachment, go to the website, apply, and wait for the result. So how to choose the right program? It depends on what you're looking for. If you're looking for a skill upgrade, go for shorthand courses. You have the IRCAD, you have the Davos course, and in India you have the IMAST. For clinical observership, WOFAPS fellowship is a good option. Gosh is a good hospital, and Sick Kids in Toronto is another hospital where you can go for observership. For career advancement, short-term fellowships are there in place. For global surgery, after you become a consultant, you can go for the Kids OR and the Smile Train. So consider they will consider the eligibility, the funding, the duration, and the visa requirements. So this Gyani Gasilini Children Hospital, I found a manuscript about it in the Pediatric Hematology Oncology. It is there since 1938. Can you imagine such an old hospital? And they offer training opportunities to pediatric surgeons. So with the WOFAPS International Guest Scholarship, one can get a scholarship for 4 weeks to 12 weeks, which supports the travel and the accommodation. And it is for young pediatric surgeons less than 40 years of age from the lower middle income countries. You get in contact with the mentor, tell them that you want to come and you want to apply for WOFAPS scholarship, apply for it. If you get it, then you can proceed. And obviously before application, you have to take the permission of your head of department and the president of IAPS. Why WOFAPS? Because you can go to a place of your choice And the WOFABS is strongly committed to education, training, and capacity building. When you come back, you send a report back to WOFABS, and you have a platform of networking, leadership, and academic collaboration. WOFABS supports you throughout, and later on also, when you want to attend the WOFABS conferences, you can apply for WOFABS grants, which can waive you off the registration fees for the WOFABS congresses. The IRCAD pediatric surgery course in France, we are lucky that in India also in Indore it has started. So it's a hands-on course in pediatric laparoscopy and robotic surgery, high-end simulation and robotic lab. The Davos course in Switzerland is quite famous. They now have a pediatric surgery module, though it's quite expensive, 1600 Swiss franc. That is approximately 1.6 lakh rupees. Short laparoscopic courses in India, we had done the ICH Bangalore course, which ran from 2002 to 2020. Dr. Ramesh, I just contacted him. And the IMAST course, Dr. Rasik Shah is running that. We had 2 workshops on thoracoscopic repair. The Squirrel course by Dr. Jui from Mumbai is also started. In the USA, you have the Nationwide Children's Hospital, which provides observerships, apart from Cincinnati Hospital, the Gianni Gaslini Institute in Italy, and the ISTP program in UK. This is quite a good fellowship program run by the Royal College of Surgeons. You have to apply through your institute with a memorandum of understanding. The applications are screened, you're interviewed, and then you're placed in contact with a mentor depending on what you have opted for. The application can take 6 months, so apply well in advance. Great Ormond Street Hospital does offer visiting observership in pediatric surgery. Sick Children Hospital in Canada is quite good. The Indian Association of Pediatric Surgery offers the Shanti Talwar and Anna Malai fellowships for observership in India, and recently they've started supporting partial support for overseas training. The Kids OR is a global surgery initiative, and once you have become a consultant and you just want to go and help and with global work, you can join that. If you're interested in cleft lip and palate, the Smile Train is a good option. So the global distribution of the training programs we've already discussed. So considering the visa and funding options, so funding, WOFABS can fund you, then ICMR fellowships are there, self-funded courses are there, and for visas you need short-term observer visas, a Schengen visa, UK visa, Canada visa. For USA, a tourist visa which is valid for 10 years is okay for observership, but if you want hands-on, then you'll have to go for a separate visa. So suggested training pathways: if you're a resident, then you go for observership to any of the hospitals. After your residency, you can opt for the pediatric urology fellowships, which is available as SGPGI and Apollo Chennai. Then early faculty, if you're an early faculty, you can go for the IRCAD and the Gassini short fellowships. The cost versus duration versus benefit. So low cost, short duration, high visibility is the WOFABS scholarship. Moderate cost is the IRCAD, and higher cost is when you go for longer duration for career advancement. To summarize, the courses and the observerships and short fellowships can be decided depending on what you want and when you want, and you should apply early with strong institution support so that your application is accepted. Thank you so much. Thank you.